Hey guys, Dr. Adil here. So today we're going to be talking about back pain. Specifically, if you have a history of injuring your back or you're suffering with back pain, how can you train around it or how can you train with it? So I'm very fortunate in that I've worked as a personal trainer, and then I also did sports medicine, and then I also did additional training in interventional pain, meaning I treat chronic back pain. So I have an expertise in applied biomechanics as well as expertise in regenerative medicine and interventional pain. So I'm trying to provide the best available evidence to patients suffering with this problem. So let's get into it. So first, what's the cause of back pain? So the actual cause of chronic back pain is mechanical for most people. What that means is that it's not usually a structural issue like a disc herniation or something like that. It's actually meaning it's because of the muscle instability or the imbalances in the muscle that causes extra strain on the back, causing pain. So there's lots of people who have degenerative disc disease or who have arthritis or wear and tear in the back. It's just a normal part of aging, but that's not necessarily the cause of back pain. What triggers back pain in most people is essentially the biomechanical imbalances and weakness in the muscles that leads to chronic inflammation and pain. Now, of course, there are exceptions to that where people have an acute injury or trauma and then they have an acute disc issue. But that's not what we're talking about. We're really focusing on more of the mechanics and how to optimize and prevent back pain from that perspective. So many people are scared to train in the gym because they've hurt their back or they're suffering from back pain. So that's actually the opposite of what you need to do. You actually need to strengthen and train those muscles and learn how to do it in a safe and effective way. One of the key ways to do this is to train the muscles around the back, the supporting musculature, and strengthen that. So I'm a huge fan of, for example, Pilates, where they strengthen the diaphragmatic and the pelvic floor muscles, as well as the core stabilizer muscles all around there to help prevent back pain. So this is actually quite comprehensive, and it's not just focusing on just, generic core strengthening where you're just kind of strengthening your lower back muscles. There's actually a lot more involved in the core. And so there's a lot of different muscles that engage in that. And you need an expert who can guide you in terms of how to progress that in a safe way. Now, one of the tips I have for people is to do variations of squats or deadlifts so that you can still get those movements in a safe way. So for example, even if you hurt your back and you have quite a bit of pain, you can just do air squats or air deadlifts where you're not using any weight, but you're just doing the movement to get that motion in, which can help to build mobility, and then eventually you can start progressing it once your pain is getting less. Now, another thing that you'll see me doing in the video is that I do something called blood flow restrictive training. So blood flow restrictive training is where you use these wraps and you tighten them about at a 7 or 8. So meaning you don't want it to be like a 10 out of 10 tightness. You want it to be somewhat tight, but not too tight. And so that does take some practice, but try to figure that out on your own in terms of how to do that. But that's kind of the range that you want to be in. And the idea is that it doesn't stop blood flow from going in, but it stops blood flow from kind of going out. And so it allows it to accumulate in there. And what that blood flow restrictive training does is it causes all these metabolic byproducts to accumulate in the muscle. And when they accumulate, you get a really significant burn, and then it also causes muscle hypertrophy or growth of the muscle. And it's a way to train around if you're injured, and then it's also a good way to actually progress for powerlifting and helping with strength. There's been studies on that. The way I usually do it is you do 4 sets. You do 1 rep of 30 reps and then 3 sets of 15 reps. And I usually like to superset. What that means is you're doing, for example, you would do a leg extension and a leg curl because they're antagonistic muscles, meaning one muscle is the opposite of the other. So you're doing quadriceps, and then you're training your hamstrings, or you'd be doing biceps and triceps. So that's kind of the idea of how to do that. And again, if you're doing blood flow restrictive training with the leg machine and leg curl exercise, even if you have back pain, it shouldn't flare it up because of the mechanics of it. You're not putting any stress on your lower back. And then you're still strengthening the muscles around there, like your glutes and hamstrings, which can help to offload or unload the back. So that's why it's really important to strengthen the musculature around there in that sense. One of my pet peeves is pain doctors always telling their patients to stop deadlifting and stop squatting because they have a history of back issues. Yes, you don't want to necessarily do barbell back squats if you have degenerative disc disease because that can put a compressive load on your spine. However, there's so many variations. There's something called hip belt squats, which are actually very safe, and they can actually help strengthen all your musculature around there, and they don't put any stress on your lower back. Then there's also something called split squats, which can be safe as well. And so instead of listening to the pain doctor who actually knows nothing about exercise mechanics, you need to follow someone like the muscle doc, who I'm friends with, Jordan Shallows, who talks about applied biomechanics and how to actually apply that to prevent and train safely. So that's actually how you do it, not listening to some pain doctor who's never actually trained in their life. That's just the reality of it. They don't know anything about exercise mechanics, and nor do they need to. That's not their job. But unfortunately, they're giving advice to people that's not relevant. So what if you're in a situation where you have too much back pain and you can't actually train or progress? So this is actually where people come to see me. So this is where I do my thing, where we do injections, either cortisone injections, which are anti-inflammatory to reduce pain, or what's called platelet-rich plasma injections, where we use your own blood and use the platelets, and those platelets help reduce inflammation and pain and can help the disc heal. And all these things can help to reduce the inflammation so that you can progress with exercise. They're not necessarily meant to be a curative thing on their own, but they're meant to be in conjunction with exercise. Even the plasma injections, even though they have a regenerative effect in healing the disc, if you don't fix the underlying biomechanics, you're just gonna get injured again. And so that's why it's so important to address those underlying factors. And you need a skilled professional who knows how to do that. All right, guys, so that's it for the video. Share this with someone who you think is suffering from back pain or who has suffered with back pain. It could be really helpful for them so they're not scared to train and exercise. That's really the key to longevity and prevention of back pain and even treating it. So please subscribe, please comment if you have any questions, and share with anyone you know suffering from back pain.